Good day, my name is Margaret Ann Magtoto. I am from Section 4, NU7, Group 4, and I will be representing our thesis entitled Exploring Student Nurses' Approaches in Reducing Stranger and Separation Anxiety in Hospitalized Infants and Toddlers. Children are undergoing changes not only physically but emotionally and psychologically. So we all know that children development occurs rapidly, so we must take note of these changes and provide the appropriate nursing care. Next, children change behavior when they are hospitalized. So since they are in a new environment, it feels strange for them. So fear of being separated from their parents poses up as a problem. Next is the nurse must understand how the mind of the child works to provide appropriate nursing interventions. We must understand how human minds work to give proper nursing interventions. And last, it is the nurse's job to pacify the children's anxiety in order to hasten the recovery from the illness. Child's cooperation may help hasten recovery from the illness. A child will develop an illness, so this will force them to seek medical consultation, which would show hospitalization. Then next, the child will experience some problems such as separation anxiety and stranger anxiety. So now nursing interventions will be applied to the child as she is hospitalized. Then these children will respond differently to those nursing interventions done. Separation anxiety is a normal developmental stage. It should have helped children master their environment and usually starts at 6 to 7 months and ends when the child is around 2 years of age. Now, stranger anxiety is the distress that young children experience when they are exposed to people who are unfamiliar to them. For our operational definitions, student nurses' approaches refers to actions of the student nurse such as playing with children, minimizing separation from parents, and applying diversionary techniques. Hospitalized infants and toddlers refers to children with ages 3 months to 2 years old which are confined to due to medical complaints. Separation anxiety refers to actions of infants and toddlers such as crying, tantrums, and irritability. Stranger anxiety refers to actions of infants and toddlers which includes withdrawal from the student nurse and from the members of the medical team. How do children behave during hospitalization? How do student nurses' interventions of procedure affect the hospitalized children? Why do hospitalized children behave the way they do in the hospital? And lastly, what were the approaches used by the student nurses to reduce the stranger and separation anxiety of the hospitalized infants and toddlers? To describe the behaviors of children during hospitalization. To determine the behaviors of hospitalized children when nursing interventions are done. To determine the reasons for the children's behavior, and to determine approaches used to reduce anxiety during hospitalization. The researchers were able to devise questions which they formed into a questionnaire. Now this questionnaire was validated by an expert and their recommendations were used to further refine the questionnaire. Now this questionnaire was used to perform the interview. Then the results of this interview was further collected and then collated. After that, it was clustered and was categorized by themes, which led to the synthesis of ideas and was further made into concepts. Behaviors of children during hospitalization. So we were able to categorize this into 4, namely verbal, emotional, social, and psychomotor. So for our verbal behaviors, the respondents found out that the children usually have temper tantrums, which is shouting with crying and protesting. So temper tantrums are normally part of infants and toddlers' behaviors. Now for our emotional, we were able to find out that most infants and toddlers cry, are irritable, afraid, angry, though some are not afraid. So these children, as one of the respondents stated, pag lumalapit yung nurse, minsan umiiyak o masungit sila sa nurse, siguro dahil hindi sila sanay sa ibang tao. This is because these children have difficulty expressing their feelings verbally, so they express it through crying. So now for our social behaviors, we have aloof, uncooperative, cooperative, and there are some children who have no reaction at all. Now for our psychomotor behaviors, most of them cling to their parents, slaps the nurse, withdraws self, and avoids eye contact. So, since these children have a limited number of coping mechanisms, their reactions are largely influenced by their developmental age, in which that infants can already discriminate between familiar and unfamiliar people. This is when they develop stranger anxiety, which is usually at 6 months of age. And while toddlers still have their stranger anxiety, they also develop what we call separation anxiety in the process. So they are also known to be negativists. Now let's proceed to reactions of children to nursing interventions. So the researchers specifically chosen for interventions like vital signs taking, giving oral medications, IV regulation, and nebulization. So according to our respondents, they found it difficult the most to take the vital signs. This is due to the fact that vital signs taking requires a lot of physical touching. So these children are terrified of strangers touching them. Now let's proceed to reasons for infants and toddlers' behaviors. So according to our respondents, we experienced the most fear, mistrust, trauma, and their condition and illness. So these children usually behave that way due to fear. So since these children do not have any past experience that they could draw upon, they usually show a fear of the unknown and the fear of pain. Now for the last result, we got approaches of student nurses. So we have 4 categories: with the parents' help, going with the mood, play, and touching the child. So according to our respondents, most of them used play therapy. Some of them use accessories with their medical equipment, while some use real toys for the children. And most of them actually ask help from the parents in order to get the participation of these children. We therefore conclude that the behavior that was most common was the emotional behaviors, which was usually crying. So now, for the nursing interventions that was done, most of them reacted unfavorably, especially to the vital signs taking. Now for the why they behave that way, it is due to fear. Usually they have a fear of the unknown and fear of pain. And for what interventions were done by the student nurses, they usually utilized play and family-centered care. With this, we end with words of wisdom from Joseph Chilton Pearce. Play is the only way the highest intelligence of humankind can unfold. Thank you for listening. Please vote for us.